So, doctor, the decision whether to wear a mask seems to have become a political debate. Even though it's been proven to slow the spread of the virus, Trump refuses to follow CDC guidelines and wear one in public. He even mocked Vice President Joe Biden for wearing one. Tell me, are you worried about the messaging coming out of the White House, sir?
Well, first of all, I regret that it's become that kind of an issue. We need to keep it as a science issue. That's how I approach things and will continue to approach things. I think that masks can play a role in reducing the transmission of this virus, but I think at the same time, there's been an effort made to put masks forward as the solution. They are not. It is about distancing. We have calculated, for example, if you had someone who was infected with the virus, who had a cloth mask on, which, remember, it leaks out of the sides. It's not just the fact that the material in front of you and these aerosols we just talked about will leak easily out of the sides. So if I'm standing next to a person who has a mask on and they're infected, or in turn I'm infected and they're not, within 2 minutes you will transmit the virus sufficiently in enough level to cause transmission and they become infected. If both people have masks on, that's 4 minutes. That surely is a help. But as you can see, that's not the answer. It's about distancing. It's a combination with masking. It's washing hands. And it's, again, about you putting yourself into the position of being around a number of people that could transmit to you. So I think we need to bring this whole issue back. It is not the overall answer that some who have never studied aerosol science are purporting. At the same time, when you can do anything to reduce the risk, that's important.
Megan?
Recently, so let me just want to ask you a personal question. I have to go. Let's say I'm going to the doctor next week, or somebody who's watching has to go to the doctor. Is it safe to go to the doctor if he's wearing a mask, or she, and I'm wearing a mask, and we're washing our hands? Is that cool or not?
Well, I just got done sharing with you that if one of you are infected and you're in a room together for 2 minutes or more, you will likely transmit to each other. On the other hand, that surely is better than not having some protection where that transmission is much quicker. So when you ask, is it safe? Nothing around this pandemic right now is safe. Is it safer? What can we do to reduce the risk? Distancing is key. If you're, in fact, ill, you shouldn't be at work. If you're ill going, then there should be a protocol for how you are seen, and that risk is reduced when you're in the doctor's office. We're seeing patients all the time with infectious diseases, whether they're measles or chickenpox, or in this case, COVID-19. So every office should have a protocol to make sure that that risk is reduced between you and the clinician who's seeing you.